What if I told you that medications your doctor prescribed to help you are actually destroying your brain and triggering dementia symptoms that look exactly like Alzheimer's disease? Are you experiencing memory loss, confusion, or difficulty concentrating that started or worsened after beginning a new medication? Do you know someone whose personality changed dramatically after taking common drugs for allergies, sleep, or bladder control? The medications I'm about to reveal are taken by millions of seniors every day, and research shows they increase dementia risk by up to 54% while causing immediate cognitive decline that's often misdiagnosed as Alzheimer's when it's actually drug-induced and potentially reversible. Welcome to the Milestone Mentor, where we expose dangerous medical practices that harm seniors and give you information your doctor should tell you but often doesn't. If you're taking multiple medications and want to protect your brain from drug-induced dementia, hit that subscribe button right now and ring that notification bell, because this information could save your mind and your future. Don't wait. Subscribe now. I'm revealing the 9 most dangerous medication classes that trigger dementia, why they're so toxic to aging brains, how to recognize if you're experiencing drug-induced cognitive decline, and what to do if you're taking these medications right now. Are you ready to discover which popular medications are destroying your brain? Let's protect your cognitive health together. Let me explain what drug-induced dementia is and why it's a massive problem that affects millions of seniors, yet is rarely diagnosed or acknowledged. Drug-induced dementia refers to cognitive impairment, including memory loss, confusion, difficulty concentrating, personality changes, and functional decline that's directly caused by medications, rather than Alzheimer's or other neurodegenerative diseases. The terrifying part is that drug-induced dementia looks identical to Alzheimer's disease, with the same symptoms and progression, leading doctors to diagnose Alzheimer's and prescribe more medications, when the actual solution is removing the offending drug. Studies estimate that 10 to 30% of suspected dementia cases in seniors are actually caused or significantly worsened by medications, meaning hundreds of thousands of people are living with preventable cognitive impairment. A landmark study published in JAMA Internal Medicine found that people who used anticholinergic medications, which block a neurotransmitter called acetylcholine, had a 54% increased risk of developing dementia, and the risk increased with higher doses and longer duration of use. Let me ask you something. How many prescription medications are you currently taking? If you're like most seniors, you're probably on 5 to 10 different drugs, and each additional medication increases your risk of cognitive side effects exponentially through drug interactions and cumulative effects. The pharmaceutical industry and many doctors treat symptoms with pills rather than addressing root causes, creating a cascade where one drug causes side effects that are treated with another drug, which causes more side effects requiring more drugs, and your brain pays the price for this polypharmacy disaster. Now let me explain why these medications are so much more dangerous for people over 65 compared to younger adults. Because understanding your vulnerability helps you take this seriously. As you age, your liver and kidneys become less efficient at metabolizing and eliminating drugs, meaning medications stay in your system longer at higher concentrations than intended, increasing toxicity and side effects, including cognitive impairment. Your blood-brain barrier, which protects your brain from harmful substances, becomes more permeable with age, allowing drugs to enter brain tissue more easily and cause more damage. Your brain has less reserve capacity and resilience with age, meaning the same drug that causes mild forgetfulness in a 40-year-old can trigger severe dementia symptoms in a 70-year-old. You're taking multiple medications, simultaneously creating dangerous interactions that amplify cognitive side effects. And studies show that the risk of adverse drug reactions increases exponentially with each additional medication beyond 5. Your acetylcholine levels, which are critical for memory and cognition, naturally decline with age. And taking anticholinergic medications that further block acetylcholine creates a catastrophic deficit that destroys cognitive function. Dehydration, which is common in seniors, increases medication concentration in your blood, amplifying side effects, including brain fog and confusion. Now let me reveal the first 3 medication classes that trigger dementia, starting with the most dangerous and widely prescribed. First, antihistamines, particularly first-generation antihistamines like diphenhydramine found in Benadryl, Tylenol PM, and many over-the-counter sleep aids are strongly anticholinergic and cause significant cognitive impairment even after single doses. These medications cross the blood-brain barrier and block acetylcholine, which is essential for memory, learning, and attention. And chronic use is associated with dramatically increased dementia risk. The JAMA study found that people who took diphenhydramine or similar antihistamines for 3 years or more had a 54% increased risk of dementia, and even short-term use causes measurable cognitive impairment in seniors. Safer alternatives include second-generation antihistamines, like loratadine or cetirizine, which don't cross the blood-brain barrier as readily, or better yet, addressing allergy root causes through diet and environmental changes. Second, tricyclic antidepressants like amitriptyline, doxepin, and imipramine are among the most anticholinergic drugs ever created and should almost never be prescribed to seniors. Yet they're still commonly given for depression, nerve pain, and sleep, despite safer alternatives being available. These medications cause severe cognitive impairment, including memory loss, confusion, hallucinations, and delirium, especially in people over 65. And they significantly increase dementia risk with long-term use. Safer alternatives for depression include SSRIs like sertraline or escitalopram, which have minimal anticholinergic effects. Or better yet, addressing depression through therapy, exercise, and nutritional interventions. Third, bladder control medications like oxybutynin, tolterodine, and sulfasenacin used for overactive bladder and urinary incontinence are powerfully anticholinergic and cause devastating cognitive effects in seniors, including severe memory impairment and increased long-term dementia risk. A study in JAMA found that these medications significantly impaired memory and attention in older adults even at standard doses, yet millions of seniors take them daily. Safer alternatives include behavioral interventions like timed voiding and pelvic floor exercises, lifestyle modifications, or newer medications with less anticholinergic activity. Let me continue with 3 more medication classes that damage cognitive function and increase dementia risk. Fourth, benzodiazepines, including diazepam, lorazepam, alprazolam, and temazepam, prescribed for anxiety, sleep, and muscle spasms, are highly dangerous for seniors, causing immediate cognitive impairment, increased fall risk, and significantly elevated long-term dementia risk. Multiple studies have found that benzodiazepine use is associated with 30 to 50% increased dementia risk, with longer duration and higher doses creating greater risk. And these medications also cause dependence, making them difficult to stop. Research shows that benzodiazepines impair memory formation, reduce attention span, cause confusion, and increase the risk of delirium in hospitalized seniors. Safer alternatives include cognitive behavioral therapy for anxiety and insomnia, melatonin for sleep, or short-term use of medications, with shorter half-lives under close medical supervision. Fifth, proton pump inhibitors, or PPIs, including omeprazole, esomeprazole, and lansoprazole used for acid reflux and ulcers, have been linked to increased dementia risk in multiple studies, though the mechanism isn't fully understood. A study in JAMA Neurology found that people who used PPIs regularly had a 44% increased risk of dementia compared to non-users, and the risk increased with longer duration of use. PPIs may contribute to dementia by reducing vitamin B12 absorption, which is critical for brain health, increasing beta amyloid levels in the brain, or through other mechanisms still being researched. Safer alternatives include H2 blockers, like famotidine for short-term use, lifestyle and dietary changes to reduce acid reflux, or addressing root causes like obesity, hiatal hernia, or H. pylori infection. Sixth, anticholinergic antipsychotics and antiemetics, including medications like promethazine, prochlorperazine, and older antipsychotics, cause severe cognitive impairment and should be used with extreme caution, if at all, in seniors. These medications block acetylcholine receptors throughout the brain, causing confusion, memory loss, and sedation. And chronic use significantly increases dementia risk, while providing questionable benefits for conditions like nausea or agitation. Let me reveal the final 3 medication classes that threaten your cognitive health. 7th, muscle relaxants, including cyclobenzaprine, methocarbamol, and carisoprodol, prescribed for back pain and muscle spasms, are often highly anticholinergic and sedating, causing cognitive impairment, falls, and confusion in seniors. These medications provide minimal benefit for most muscle pain while creating significant risks, and they should generally be avoided in people over 65. Safer alternatives include physical therapy, gentle exercise, heat or ice application, and addressing underlying causes of muscle pain rather than masking symptoms with dangerous drugs. 8th, certain anti-epileptic drugs, particularly older medications like phenobarbital, phenytoin, and carbamazepine, can cause cognitive impairment, including memory problems, slowed thinking, and difficulty concentrating. While newer anti-epileptics like lamotrigine and levetiracetam have better cognitive profiles, all anti-epileptic drugs should be used at the lowest effective dose and monitored carefully for cognitive side effects in seniors. For people taking these medications for conditions other than epilepsy like nerve pain or mood disorders, alternative treatments should be considered. 9th, certain cardiovascular medications, including some beta blockers, particularly propranolol, which crosses the blood-brain barrier, and certain blood pressure medications can cause cognitive side effects, including memory problems, confusion, and depression. While these medications are often necessary for heart health, using the lowest effective dose and choosing medications with fewer cognitive effects is important. Now, if you're shocked to learn how many common medications damage your brain and you're worried about what you're currently taking, subscribe to the Milestone Mentor right now, because we expose medical dangers like this every week. Subscribe now. Let me teach you how to recognize drug-induced cognitive decline so you can identify if medications are affecting your brain and take action before permanent damage occurs. Drug-induced dementia typically begins within weeks to months of starting a new medication or increasing a dose, so new or worsening memory problems, confusion, or personality changes that coincide with medication changes are highly suspicious. Symptoms often include acute confusion or delirium, particularly in hospitalized seniors given multiple anticholinergic medications intravenously, and this acute cognitive decline should always raise suspicion of medication effects. You might experience difficulty finding words, trouble concentrating, slower thinking, problems with complex tasks, short-term memory loss where you forget conversations or appointments, disorientation about time or place, personality changes, including increased irritability or apathy, and visual hallucinations or paranoia, particularly with anticholinergic medications. Family members often notice changes before you do, so if loved ones express concern about your memory or behavior, take it seriously and review your medications with your doctor. Drug-induced cognitive impairment often fluctuates with worse symptoms when medication levels are highest and slight improvement when levels drop, whereas true Alzheimer's shows steady progressive decline. If you stop the offending medication under medical supervision and your cognitive symptoms improve or resolve within days to weeks, this confirms drug-induced rather than degenerative dementia. A critical test is the anticholinergic burden score, which adds up the anticholinergic effects of all your medications. And if your total score is high, you're at severe risk for cognitive impairment and should work with your doctor to reduce this burden. Now let me explain how multiple medications with mild anticholinergic effects can combine to create devastating cognitive impairment even when no single drug seems dangerous. Many medications have mild anticholinergic properties that wouldn't cause problems alone, but when you take multiple such medications simultaneously, their effects add up, creating a high anticholinergic burden that impairs cognition severely. Common medications with mild to moderate anticholinergic effects include certain antidepressants, antihistamines, urinary incontinence drugs, medications for Parkinson's disease, some pain medications, certain heart medications, and many over-the-counter sleep aids. A study found that seniors taking medications with a total anticholinergic burden score of 3 or higher had significantly worse cognitive function and higher dementia risk compared to those with lower scores. The accumulation of multiple medications, even seemingly harmless ones, creates a toxic environment for your brain, particularly when combined with age-related decline in acetylcholine production. You might be taking an antihistamine for allergies, a tricyclic antidepressant for nerve pain, a medication for overactive bladder, and a sleep aid, not realizing that together they're creating catastrophic cognitive impairment. This is why comprehensive medication reviews are critical, where a pharmacist or geriatric specialist evaluates all your medications, including over-the-counter drugs, and calculates your total anticholinergic burden. Let me give you a step-by-step guide for talking to your doctor about potentially dangerous medications, because many doctors are resistant to changing prescriptions, and you need to advocate strongly for your brain health. Schedule a dedicated medication review appointment rather than trying to discuss this during a visit for another problem. And bring a list of all your prescription medications, over-the-counter drugs, and supplements with doses and frequency. Research your medications using reliable sources like the Beers Criteria, which is a list of medications that are potentially inappropriate for seniors. And note which of your medications appear on this list or have significant anticholinergic effects. Prepare specific questions like, does this medication have anticholinergic effects? What's my total anticholinergic burden score? Are there safer alternatives? Can we try reducing the dose or stopping this medication? Could my cognitive symptoms be related to my medications? Be direct about your concerns, saying something like, I'm experiencing memory problems and confusion that I'm worried could be related to my medications, and I want to review whether any of my current drugs could be contributing to cognitive decline. If your doctor dismisses your concerns or refuses to consider medication changes, seek a second opinion from a geriatrician or pharmacist who specializes in medication management for seniors. Bring a family member or friend to appointments for support and to help remember the discussion, and take notes or ask permission to record the conversation. Request a deprescribing plan, which is a systematic approach to safely reducing or eliminating medications that may be causing more harm than good, and many geriatricians are trained in deprescribing protocols. Never stop medications abruptly on your own, especially benzodiazepines, antidepressants, or blood pressure medications, because sudden withdrawal can be dangerous. But do work with a supportive physician to create a safe tapering plan. Now, let me share safe alternatives to the dangerous medications I've discussed, so you have options when working with your doctor to reduce your anticholinergic burden. For allergies, instead of first-generation antihistamines like Benadryl, use second-generation antihistamines like loratadine or cetirizine, which don't significantly cross the blood-brain barrier. Or better yet, identify and eliminate allergen triggers. Use nasal saline rinses, try local honey for seasonal allergies, or use air purifiers to reduce environmental allergens. For sleep problems, instead of anticholinergic sleep aids, try melatonin supplements at doses of 1 to 3 milligrams 30 minutes before bed. Improve sleep hygiene with consistent bedtime routines and dark, cool rooms. Use cognitive behavioral therapy for insomnia, which is more effective than medications long-term. Try magnesium glycinate, which promotes relaxation, or address underlying causes like sleep apnea, pain, or anxiety. For depression, instead of tricyclic antidepressants, use SSRIs like sertraline or escitalopram, which have minimal anticholinergic effects. Try therapy, particularly cognitive behavioral therapy, which is as effective as antidepressants for mild to moderate depression. Increase exercise, which has powerful antidepressant effects. Optimize vitamin D levels as deficiency contributes to depression, or try bright light therapy for seasonal depression. For overactive bladder, instead of anticholinergic medications, practice timed voiding where you urinate on a schedule rather than waiting for urgency. Do pelvic floor exercises, also known as Kegels, to strengthen bladder control muscles. Maintain a healthy weight as obesity worsens bladder problems. Limit caffeine and alcohol, which irritate the bladder. Try bladder training to gradually increase time between bathroom visits. Or use disposable absorbent products as a bridge while implementing behavioral changes. For anxiety, instead of benzodiazepines, try cognitive behavioral therapy, which teaches skills for managing anxiety. Practice regular exercise, which reduces anxiety as effectively as medications. Learn breathing and relaxation techniques. Try mindfulness meditation. Address lifestyle factors like caffeine intake and sleep quality. Or consider SSRIs, which are effective for anxiety disorders without the cognitive impairment and dependence risk of benzodiazepines. Let me walk you through the deprescribing process, so you know what to expect when working with your doctor to safely reduce or eliminate dangerous medications. Deprescribing means systematically reducing or stopping medications that may be causing more harm than good, and it's done gradually under medical supervision to avoid withdrawal symptoms or disease flare-ups. The first step is a comprehensive medication review, where you and your doctor list all medications and assess whether each one is still necessary, whether the benefits outweigh the risks, whether there are safer alternatives, and what your total anticholinergic burden is. The second step is prioritizing which medications to address first, typically starting with those causing the most obvious problems, those with the highest anticholinergic burden, those being used for unclear indications, or those that duplicate other medications. The third step is creating a tapering schedule for each medication you're discontinuing, because abruptly stopping most medications is dangerous and can cause withdrawal symptoms, rebound effects, or sudden disease worsening. For benzodiazepines, tapering takes weeks to months depending on duration of use and dose, reducing by 10 to 25% every 1 to 2 weeks, while monitoring for withdrawal symptoms. For antidepressants, tapering usually takes several weeks, reducing the dose gradually, while watching for discontinuation syndrome. For blood pressure medications, tapering is done more cautiously with frequent blood pressure monitoring to ensure pressures don't spike dangerously. The fourth step is monitoring during and after deprescribing to watch for withdrawal symptoms, worsening of the original condition, improvements in cognitive function as the medication clears your system, and any unexpected effects. Many people experience dramatic cognitive improvements within days to weeks of stopping anticholinergic medications, with memory and confusion improving significantly once the drug is out of their system. Let me share strategies for preventing drug-induced dementia so you protect your brain from pharmaceutical damage throughout your life. Always question new prescriptions by asking, is this medication absolutely necessary? Are there non-drug alternatives? What are the cognitive side effects? Is this on the Beers criteria list of inappropriate medications for seniors? And never accept a prescription without understanding why you're taking it and what the risks are. Start with the lowest effective dose of any medication, because cognitive side effects are often dose-dependent, and increasing doses gradually allows you to find the minimum dose that provides benefits while minimizing risks. Review all your medications, including over-the-counter drugs, at least annually with your doctor or pharmacist, and bring all bottles to appointments so nothing is missed. Avoid medication cascades where side effects from one drug are treated with another drug, and always ask if new symptoms could be medication side effects, rather than new diseases requiring more pills. Use non-drug treatments first for conditions like insomnia, mild anxiety, or mild pain, trying behavioral interventions, lifestyle changes, and complementary approaches before resorting to pharmaceuticals. Keep an updated medication list including drug names, doses, prescribing doctors, and reasons for taking each medication. And keep this list in your wallet and share it with all your healthcare providers. Use one pharmacy for all prescriptions, so pharmacists can check for interactions and duplicate therapies. And build a relationship with your pharmacist who can be a valuable ally in medication safety. Be wary of over-the-counter medications, particularly sleep aids and allergy medications, which often contain anticholinergic drugs, and read labels carefully looking for diphenhydramine, doxylamine, or other anticholinergic ingredients. Advocate for yourself by speaking up if you notice cognitive changes after starting a new medication. And don't let doctors dismiss your concerns as just aging without investigating medication effects. Now let me give you hope by explaining that drug-induced cognitive impairment is often reversible if caught early and addressed appropriately, unlike Alzheimer's disease, which is progressive and irreversible. When you stop taking anticholinergic or other cognitively impairing medications, Your brain can recover significantly, with many people experiencing dramatic improvements in memory, confusion, and overall mental clarity within days to weeks. A study published in the Journal of the American Geriatric Society found that seniors who discontinued anticholinergic medications showed significant improvement in cognitive test scores within just 6 weeks of stopping the drugs. The degree of reversibility depends on how long you've been taking the medications and whether any permanent damage has occurred. But even people who've taken these drugs for years often experience meaningful cognitive improvement after stopping. Some people who were diagnosed with Alzheimer's disease and placed on dementia medications actually had drug-induced dementia. And when the offending drugs were stopped, their Alzheimer's dramatically improved or resolved completely. This is why it's critical to consider medication effects whenever someone develops cognitive symptoms, and why stopping anticholinergic drugs should be part of the evaluation for any senior with memory problems. Your brain has remarkable plasticity and healing capacity even in older age, and removing toxic medications allows natural repair processes to work. Many people report that after stopping anticholinergic medications, they feel like a fog has lifted, and they can think clearly again for the first time in months or years. While you're recovering from drug-induced cognitive impairment, support your brain with omega-3 fatty acids from fish, B vitamins, particularly B12 and folate, regular exercise which promotes brain health, cognitive stimulation through reading and puzzles, social engagement, and adequate sleep. Are you ready to review your medications and protect your brain from drug-induced dementia? The choice is yours, but drug-induced dementia is largely preventable and often reversible if you take action now. Here's what to do immediately. First, subscribe to the Milestone Mentor right now. Hit that subscribe button and turn on notifications, because we're exposing medical dangers every week that your doctor won't tell you, so subscribe now. Second, make a list of every medication you're taking, including over-the-counter drugs. Research each one using the Beers criteria online and identify which are potentially dangerous for your brain. Third, schedule a medication review appointment with your doctor. Bring your list and advocate strongly for safer alternatives or deprescribing protocols. Fourth, share this video with everyone over 65 because millions are taking brain-damaging medications without knowing it. So post it on social media and help spread this critical message. Leave a comment telling me how many medications you're taking and whether any are on this list. Remember, your brain is your most precious asset, and protecting it from pharmaceutical damage should be your top priority. Thank you for watching the Milestone Mentor. Now go review your medications and protect your brain. Subscribe, and I'll see you in the next video.